Step into any of Parkway Health's hospitals in Singapore, and you will discover that quality healthcare means more than medical care. Parkway Health offers accessibility of specialized medical procedures, quality of personalized care, and treatment at its 3 well-established hospitals: Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital. At Parkway Health, quality healthcare is about total patient's experience. It is also about tender, loving care at every touchpoint in any of its hospitals. Our reputation for excellence has not gone unnoticed. Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital are Joint Commission International accredited, demonstrating our commitment to quality, safe, and efficient patient care. Recognized worldwide as one of the leading healthcare providers, Parkway Health has a pool of experienced medical specialists, invests in medical technology, and the right infrastructure to provide value-based integrated healthcare. Parkway Health offers clinical programs that are tailored for patients to experience holistic and comprehensive care under a team of specialists. With more than 1,200 accredited specialists covering over 40 multidisciplinary specialties, patients can expect quality care and be assured of our integrated facilities and expertise, which are grounded in good clinical practice. Whether patients' needs are basic or complex, they find reassurance in Parkway Health's facilities. To achieve quality clinical outcomes and for effective treatments, Parkway Health continues to invest heavily in proven and advanced medical technologies. Parkway Health also extends round-the-clock medical service through its 24-hour accident and emergency facility, providing care for life-threatening emergencies and minor urgent care medical problems. Parkway Health operates a patient assistance center to serve as a one-stop and 24-hour service center to help patients access specialists and complex medical care in Singapore. 24 hours a day and 365 days a year, our helpline service provides medical referral and assistance in over 10 languages. Our global culture means we know and understand our patients from their perspective. People from all over the globe have come to Parkway Health's 3 hospitals in Singapore for comprehensive specialist care. Beyond its reputation for medical milestones, patients come for the peace of mind, knowing they will receive quality care by our dedicated team of nurses, doctors, and staff who understand their special needs. In realizing our vision, we seek towards achieving quality clinical service and operational outcomes. This way, when our patients step out of our hospitals, we know we have made a difference in their lives. Parkway Health, your quality healthcare provider in Singapore.
Dear viewers, welcome to your very own medical show, Doctor's Voice. What we do in this program is give you some information on recent medical advancement. So here we are today also with a very vital topic, that is cancer. We know cancer is the main leading cause of death worldwide today. But sometimes we don't give enough attention to the cancer because of lack of knowledge or the absence of early symptoms. But we should focus on that. And for that, we have Dr. Peng Tiam with us today. Dr. Peng Tiam is one of the supreme oncologists of the world. After graduation, he has completed postgraduate specialization on oncology. Dr. Ang was awarded Singapore President Scholarship, Professor Sir Gordon Arthur Ransom Gold Medal, Singapore National Science Award, and many more, including a Datukship from Sultan of Kedah. Dr. Ang was founding head of the Department of Medical Oncology at Singapore General Hospital, President of Singapore Society of Oncology, Director of Oncology Center, Vice Chairman of Singapore Cancer Society, and now he is the Medical Director of Parkway Cancer Hospital. Welcome, Dr. Ang, to our show.
Thank you.
First of all, I would like to know what is the real picture of cancer worldwide today, and especially in our Southeast Asian region.
As you correctly said, cancer is the leading cause of death. You know, in Singapore, 1 in 3 persons will die because of cancer. So it is an illness which affects many people, and it's an illness that not only affects the patients alone, it affects their families, their friends. There's a high cost involved in terms of the treatment of cancer, and it's a disease that carries with it a lot of morbidity, meaning a lot of suffering, as well as in terms of mortality. In other words, patients do die from cancer. We are seeing cancer increasing, and one of the reasons is really related to our lifestyle.
Yes.
Cigarette smoking is a big no-no. You know, we know that the diets that we adopt, a very high-fat, high-protein diet, is not good for us. We know that, you know, there are certain viruses, like for example, hepatitis B virus and hepatitis C virus, that increases the risk of liver cancer, and also the viruses, human papilloma virus, that increases the risk of cervical cancer. So we are beginning to see more patients suffer from cancer, and we need to take an active step to see what we need to do to understand the problem and to solve the problem.
So what should we do? First, diagnosis and then go for the treatment. So
I always say that there are 3 strong pillars in any cancer control program. The first pillar is in terms of prevention of cancer.
of course.
The second is early detection, and the third is treatment of cancer. In terms of prevention, we need to continue to educate the public.
And grow more awareness.
That's right, you know. Some of the things that we can obviously do: stop people from smoking, discourage people from smoking, high taxes on cigarettes in order to make it harder for people to buy cigarettes, creating smoke-free zones. So prevention is a very important aspect. When we know that there are certain viruses like hepatitis B, since the 1980s, all newborn in Singapore have been vaccinated against hepatitis B. We believe that in the decades to come, the incidence of liver cancer in Singapore will gradually decline.
Okay, that's good.
Next, human papilloma virus and cervical cancer. We now have a vaccine against the human papilloma virus. By vaccinating the young ladies before they become sexually active, we can reduce the risk of them getting cervical cancer. So when you know the cause, all right, then it is important for you to implement policies to reduce the risk factor.
Yes.
So prevention forms a very important part. If patients don't get cancer, there is a less need for you to treat them. The second is obviously early detection.
Yes.
We need to continue to warn the public, you know, what are the early warning symptoms of cancer: bleeding from any unknown site, a lump that should not be there, a persistent cough, you know, a sore that does not heal, and so on and so forth. So that they are alerted instead of just pretending that the symptoms are nothing serious. They should see a doctor early, have it evaluated, and help to detect cancer early. And more importantly, screening.
Yes.
All right. In the appropriate patients, you are talking about mammogram for the early detection of breast cancer. You're talking about pap smear in terms of detecting cervical cancer early. And you're talking about stool occult blood or colonoscopy in trying to detect colon cancer early. So the first pillar I mentioned about is prevention. The second pillar, early detection. And thirdly, obviously, in terms of how do we raise the standards of medical practice to provide cancer patients with the best care possible in order to cure the cancers that can be cured, or to control the disease, preserve the quality of life for patients with advanced cancer.
Dear doctor, with your kind permission, can we go for a short break? Thank you. Dear viewers, now we are going to take a very short break. Please be with us.
The fight against cancer is often a story of hope. With hope, patients and their families have an easier time coping with cancer. And hope helps them focus on the recovery process. Parkway Cancer Center has a multidisciplinary team of medical specialists, all dedicated to meeting the specific needs of cancer patients. At PCC, we use the latest technologies in cancer treatment, so patients can access proven, innovative therapies for the best clinical outcomes. We're committed to providing the most comprehensive holistic treatment for our patients. But more than that, we're their partners too, in their journey of hope. PCC, Singapore's leading cancer center.
Welcome back, dear viewers. We are talking on cancer with Dr. Peng Tiam. Doctor, in terms of the treatment, every cancer patient is an individual patient. They have different types of tumor growth.
Yes.
So, how a physician or as a whole, they decide what treatment should go, either for the chemo or the radio or the surgery?
Correct. Generally, when the disease is localized, all right, surgery plays a very important role. Yes. So you cannot possibly hope to cure a breast cancer patient who has localized disease by radiotherapy or chemotherapy without the cornerstone treatment, which is surgery. In colon cancer, you have stage 1, stage 2, stage 3, no evidence of spread. Surgery is still a very important part of treatment. Yes. But surgery alone may not be enough. Very often, you may need to add on chemotherapy and radiotherapy in the selected cases to reduce the risk of cancer recurrence. Now, almost every cancer, whether it is breast cancer, colorectal cancer, lung cancer, stomach cancer, even though the patient has undergone successful surgery, very often you need to add on chemotherapy to treat the microscopic disease, to ensure that you eradicate these small cancer cells which you cannot detect in order to maximize or optimize the patient's chances of cure. Yes. And if indeed the disease has become metastatic, if there's spread of the disease, then the use of drugs, the use of targeted agents plays a very important role in helping to control the disease and to prolong life.
And this is a very important factor about the drugs. Sometimes all the drugs are not affecting on the individual patients same or equally. So how do you choose the drug? Which one is best for that patient?
As I always say, you know, a lot of the drugs that we use, we have learned through clinical trials. For clinical trials, we say, look, you have a breast cancer, stage 4 of this particular nature. We use this particular combination, we have an 80% chance that we are going to be able to achieve improvement in your cancer and control of the disease. But there are some cancers whereby the chances are not that high. You may have a 30% chance or a 20 or a 15% chance. Now, we are now exploring, or rather we have started collaborating with a company called Champions Oncology. Yes. Champions Oncology started in the United States under Professor David Sadinsky. They have a very interesting concept that we are very interested in. What they do is, at the time of surgery, or when they intentionally go and biopsy these tumor specimens, the tumor is implanted into a nude mouse. A nude mouse is basically a mouse that has got no immune system. They allow this tumor to grow in the mouse. And they breed these mice. And then they test the various chemotherapy agents, targeted agents, monoclonal antibodies, biologicals, whatever you have, on the mouse.
That means my tumor is growing in the mouse cell.
Correct.
Okay.
Exactly. The patient's tumor, the individual patient's tumor is growing in these mice.
Yes.
They have been specially bred in order to test the effectiveness of the various agents. So instead of using the patient as the battleground for trial and error, this testing is done on the mice.
Is the
And when you have found a program that is found to be effective, this is then carried out in the human being. And we have found that the correlation is very good. What works on the tumor, what works on your tumor in the mouse, often also works in the body.
Okay.
So that's why we can now save the patient the unnecessary costs, both in terms of financial costs as well in terms of cost of side effects. All right, when the drugs are being administered to them. All drugs have side effects. All drugs have side effects. You have to suffer the side effects if you want to gain the benefit.
Yes.
But it is very sad for you to have to suffer the side effects and you don't get the benefit.
Yes, that's the
So
main
that's the
beneficial
important thing. The main advantage is that if indeed
I'm
there's a
using the
combination
mice.
that works and you have to suffer the side effects, so be it. But for you to suffer the side effects and don't enjoy the benefit, that's indeed very, very sad.
A very layman question, because some of our viewers may not be familiar with our medical terms. So how a mice cell can represent a human cell? Is there
Okay, it is
anything
not,
easy way
yeah,
to
it is
explain?
not. The mouse it is not the mouse cell that we are interested in. We are interested in growing the human cell in the mouse.
In the mouse.
And then use the drugs to treat the human cancer in the mouse.
Okay.
So the mouse is basically the battleground. Okay, the enemy.
We're just transferring the battleground to
That's
another
right.
body.
That's right. We are transferring the battleground. That instead of fighting the battle in the human body, we are now trying out this battle in the mouse first until we are sure we have got something that works. Then we do it in the human being.
Okay. What do you suggest for a patient? We have know that the patients at stage 1, 2, 3, 4, according to the severity of the cancer. So when one patient should go for this tumor grafting?
In actual fact, this is something whereby the clinician needs to guide the
Yes,
patient.
of course.
If you think that the patient has a disease which has got a high chance of cure, then there's probably no need for you to do this kind of testing. But in patients who have got stage 3, stage 4 disease, or a disease whereby it may be early stage, but we know that the long-term outlook is not good, these are certainly the patients that you're very interested in growing the tumor specimen in the mouse, thereby allowing us to test the drugs.
How long it takes
Okay.
in total?
From the time of implantation to the time we get the first results of what drugs may be effective is about 4 months. So it's a
Okay.
very long time. So this is not something that you want to try on a patient who has got a 1 month lifespan. Then you're wasting it, because you plant it, by the time you find the answer, the patient is no longer there.
Yes.
So there must be a lot of forward planning and understanding of who is the most appropriate patient for this testing to be done.
Dear viewers, now we are going to take a very short break. Please be with us. Welcome back, dear viewers. We are talking on cancer with Dr. Peng Tiam. Doctor, some of our viewers who are practicing, medical practicing viewers, they may have the question, we know about the DNA sequencing. Do you think that this tumor graft is better or have more
Of course,
advantages?
a DNA sequencing is just a sequencing.
Yes.
All right, a DNA sequencing is basically understanding the genetics. But understanding the genetics and finding a treatment that's effective are two different issues.
Of course.
So that's why we believe that this animal model is far superior than just doing the DNA sequencing.
Okay. Can you give us any idea how much the expenditure of this tumor graft
Sadly, at this point in time, it is very
is
costly.
expensive?
Just to implant and to grow the tumor specimen, not even talking about testing yet, it's going to be about $4,000 US.
Okay. That's
Okay,
very-
and after the tumor has grown, the clinician will then negotiate and discuss with the laboratory what agents they would like to try on this mouse.
Okay.
And for the first three sort of a drug combinations, it will cost roughly about another $15,000 US. So we're talking about $20,000 US for this experiment to be done.
Maybe in near future the
Of
cost will
course,
reduce.
it's all economies of scale. As more and more patients participate, then it'll be easier and cheaper for the patients to gain access to this technology.
For the tumor grafting, do we always need the fresh cell?
Absolutely. If you have done the surgery yesterday and you want to do it, it's over. So this must be something that's proactive, that the doctor, before the surgery, before the biopsy, must consider, do I want to take enough tissue for the tumor grafting to be done?
Okay, that's why I was thinking whether we can send it to you in
No, it cannot be an afterthought. It must be
impossible.
done fresh, because if it's
Freshly.
not fresh, then it is not possible for us to do it.
Suppose a cancer patient, in breast cancer she had, and then after mastectomy she is totally cured, as we think she's cured. But there is a chance for the recur. So can we keep the things as a bank? As we
Of
do the blood bank?
course. At the point of the initial surgery, if there's foresight, they say, look, we want to take enough specimen and so on. Of course, this can be banked for years and years, You don't even need to start doing the drug testing. You just need to implant, and once it's engrafted, the mice will be kept alive, the specimens will be kept, so that in the future, if it's needed for you to do the testing,
As
then
quickly.
that's right.
Okay, so the last question is how to, if somebody is got cancer, then how to access it? And
Very simple. Just contact us.
okay,
Parkway Cancer Center, we are in the region, and certainly we have an office, a Ken Hope office in Bangladesh. So there is no problem at all. Just contact the regional office that we have, and we'll be able to guide you along in terms of how to get the specimen, whether the patient probably at this point in time will need to consider coming to Singapore, and we'll be able to make all the arrangements for you.
okay, thank you. And do you want to say something for our viewers to create awareness, preventing or slowing down?
I think it's very important for everyone to know that cancer is here to stay. And for us to be able to win this war against cancer, we really need to bring together all the available best technologies in order to provide the optimal treatment for each cancer patient. Cancer is not a death sentence. It is a disease that is treatable and curable.
Thank you, doctor. Thank you very much for being with us. We know that you're very busy. It's a great honor and pleasure for us and our viewers to have you with us. Thank you so
very
much.
Thank you.
Dear viewers, we are at the end of our show. Today we have learned a lot about cancer, about the diagnosis, about the treatment, and of course about the prevention. Hope you got benefited from our show. Hope to see you next time, same channel. Keep well.
This hospital will raise the bar in terms of the delivery of private healthcare standards to its highest form.
Anything you can think of, you have the best of the best working in this hospital.
Patients deserve the best of technology and the best medical care.
It's a very beautiful place.
I'm Dr. Tan Seeling. I'm the Group Chief Executive Officer and Managing Director of Parkway Pantai Limited, the holding company that built this hospital. I believe that this hospital would put Singapore on the world map. We've invested in state-of-the-art technology, medical equipment, and the entire hospital is built centered around the patient as our main focus.
I think being a patient at the hospital is really an experience for all the senses. I feel really at ease here. There are a lot of green spaces around the hospital which my family and I can relax in, and it really cheers a patient up to have sunlight streaming through the windows and you can't even feel the heat.
We believe that the healing of a patient's illness itself is a very holistic process, and we hope that this becomes an oasis of healing, an oasis of calm. So while we put in the best medical equipment, we have the best doctors and nurses taking care of the patient, we also believe in using the environment, making it a very, very comfortable, private environment for the patients to recover. The team spared no effort in scouring the world to find out what is going to be cutting edge and what is the future that's in store in terms of medicine.
The advanced technology that is available at Mount Elizabeth Novena represents what state-of-the-art medical technology. We've got a state-of-the-art operating microscope that allows us to see beyond the surgical field, and that's critical for minimally invasive keyhole surgery. We've got the ability to check our work and ensure that we get the best results possible.
Some of the cutting-edge equipment that we have ranges from imaging equipment like the Biograph MMR. We can get very clear, detailed images onto the activity of the parts in the body without the risk of course, radiation.
The list of firsts at Mount Elizabeth Novena is really impressive, and this includes some lead-lined rooms which we use for patients with thyroid cancer, and we use them to actually give them radioactive therapy. And we're actually the first private hospital in the region to have them.
We've got a platform from an IT end that allows us to retrieve information, link up information, present data.
The beauty of electronic medical records is that we can access the records from any part of the hospital, anytime, without fail. And quick access means for faster, more efficient care for our patients.
We use the pneumatic tube system to send samples to the laboratory for quick testing, so that the doctors can access the results almost immediately.
The laboratory support is really impressive. Patients can actually have their blood tests taken and expect their results back in as short as 2 hours. And this means that even international patients can fly in, have the test done, and expect to be home maybe within the same day.
This all translates to shorter operating time, better clinical results, and of course we've got a brand new ICU here, thoughtfully designed, capable of looking after complex and difficult and very ill patients, and which is really what we want, because the patients deserve the best of technology and the best medical care.
There are 250 medical suites in this building, and we have specialists ranging from neurosurgery, cardiovascular, anything you can think of. We have the best of the best working in this hospital.
The clinic's actually linked to the wards on every floor, and this is really important for us because it allows us access to our patients in the wards at all times and enables us to keep a really close watch on them while they're recovering.
What's really impressive is that access to advanced medical treatment can be done within 48 hours. A simple weekend away for medical treatment is now a real possibility within my busy schedule, and that's life-changing.
The staff, they're really warm and professional, and they always greet you with a smile, and that's fantastic.
This hospital is really on top of technology, and I particularly like the other touches of technology that kind of completes the experience. There's Wi-Fi everywhere, and I can keep in touch with my family and stay online. And the patient console is a unique and nice feature that keeps everything within reach, like ordering food and of course selecting entertainment channels.
I've been a professional chef for the past 20 years. We have catered to many events and many products, but it's the first time I'm doing an opening for a hospital that position themselves 6-star. We have a cross-cultural menu that includes a symphony of cuisine and different cooking techniques as well as variety on the menu. We believe that by offering this kind of variety is sort of an excitement for the clients, that there will be something that they definitely want to look forward to for tomorrow's meal or the meal that's coming after.
No effort is spared in making sure that patient privacy, patient comfort and patient safety is not compromised in any way.
I like the garden very much, and the fountains and flowers. It's a very beautiful place.
A hospital that harmonizes the best technology with nature. It's possible.
The best of medical specialty under one roof. It's possible.
An exceptional team with extraordinary touch. It's possible.
A 5-star hospital cuisine is possible.
Care, comfort, and complete privacy. It's possible.
The hospital of tomorrow, here today. It's possible.
Service quality and speed with a human touch. It's possible.
Revolutionizing and setting a new paradigm in private healthcare. It is possible.